Results of Bangalore slum or backward areas pediatric eye disease study. Purpose of this study: this is an epidemiological study that was done to assess the frequency of ocular morbidity among the pediatric population, which is children less than or equal to 15 years of age of the slum areas in Bangalore, Karnataka. Study design was population-based cross-sectional study. Instruments used in this study were torchlight, Snellen's chart, pinhole, Lang's stereopsis chart, handheld autorefractometer, direct ophthalmoscope with streak retinoscope, indirect ophthalmoscope with 20D lens, refraction set with trial frame. Inclusion criteria, material and method. First was to find the survey location. For that, after getting clearance from the ethical committee of our college, we visited Karnataka Slum Development Board, Sheshadripuram, Bangalore. From there, we obtained permission for the study and obtained a list of government-recognized slums in Bangalore. Names of all the government-recognized slums in a locality were written on chit papers and shuffled, and the slum to be surveyed in that locality was picked out randomly. Similarly, one slum area from each locality of Bangalore was selected and marked on a Bangalore city map. Starting point of the survey was chosen by pencil drop method and a roadmap was made for the study. With all the instruments required for the study, we went to the PHC under which the particular slum area was registered. We took permission from the medical officer in charge and explained regarding the study and how it would be beneficial for the children. We requested the ASHA worker to take us to the field where the study is to be done and requested them to gather all the children below the age of 15 years of age in that locality along with their parents. Siddhapura slum, Wilson Garden. Informed consent is being taken here from the parent for the ophthalmic examination for the study. This is the consent form which has been used for the study. Demographic data and clinical history was taken from the parents. For the demographic data, the following details were collected: the house number, childbirth order, name of the child, the parents' name, date of birth, age and sex of the child, education of the parents and the child, the profession of the parents, and the type of house they reside in. Each child was given a unique child identification number, of which the first two letters represent the district, the next two letters the locality the child lives in, and the further two letters the slum area, and the next two are the house number of the child, and the final two are the childbirth order. Now moving on to the ocular examination, which is done at the following three stations. Station 1 is for checking the vision and stereopsis. Here the distance vision is being checked using the Snellen's chart and the stereopsis is being checked with the Lang's stereopsis card. The vision and stereopsis are recorded in this format. Station 2 is for the external ocular examination, which is done by torchlight, indirect ophthalmoscope and 20 diopter lens. External ocular examination is recorded in this format. If the examination is within normal limits, the examination is concluded at this stage. If any abnormality is found in the first two stations, the child is sent to the third station. Like here in this child who has had diminution of vision since 4 months and the vision was recorded to be 6/24 in both eyes, improving to 6/6 on pinhole. Hence the child was sent to station 3 for detailed ophthalmic examination. At station 3, the refractive error is measured by autorefractometer. Cycloplegic refraction is done with retinoscope. Dilated fundoscopy is done with indirect ophthalmoscope and 20 diopter lens. Post-mydriatic test is carried out in children with refractive errors. After PMT, we conclude that this child has myopia in both eyes and the prescription is prescribed in this form. Here we are collecting the demographic data from a mother of a 5-month-old child. Mother gives history of watering from left eye since birth. Ropla's test was positive in the left eye in this child and the child was diagnosed with left eye congenital nasolacrimal duct obstruction. Tobramycin eye drops were prescribed and Krigler's massage was advised and the child was referred to a tertiary care center for evaluation. Examination of children at Lakshman Rao Nagar, Shanti Nagar, and here the examination of children at Panchnath Colony at Vaswangudi area is taking place. Results: we have examined 2,248 children in different slum areas of Bangalore. Out of them, 147 children, which is 6.5%, had ocular morbidity due to various reasons. 53 children had refractive error, which corresponded to 36%, whereas 78 children had conjunctivitis, which corresponded to 53%. 3 children had VKC, 3 had thysical eyes, 1 had cataract, 1 had congenital nasolacrimal duct obstruction, 3 had squint, 2 had chalazion, 1 had hordeolum, 1 had albinism, and 1 had retinal detachment. This is a chart showing the vision which was recorded among the children. 2 children had no perception of light, which was due to phthisis bulbi. 3 children had vision of counting fingers close to face to counting fingers at 3 meter due to RD and pathological myopia. 9 children had vision of 6 by 60 to 6 by 24 due to refractive error and squint. 43 children had vision ranging from 6 by 18 to 6 by 12, which was due to refractive error. 2164 children had vision ranging from 6 by 9 to 6 by 6, and 27 children's vision could not be assessed. Treatment: children diagnosed with minor problems like conjunctivitis were treated in field with eye drops. 34 children with refractive errors were given spectacles for free, and 14 children were referred to higher center for further evaluation. Here, free spectacles are being distributed to the children in need. The study was completed in the following areas of the slums in Bangalore. Thank you.